Good evening, everyone. We're here today and we have a special speaker. Her name is Dr. Anita Somani. She's going to be talking today about COVID and women's health, kind of moving forward, not backward. A little bit about Dr. Anita Somani. She's an Ob-Gyn in Columbus, Ohio. She's been in practice for 28 years and has the privilege of delivering the babies that she's had delivered earlier in her practice. She's an expert robotic surgeon and has been teaching robotics to other surgeons for the past 11 years. She, like many other suburban moms, has become a political activist after the last presidential election, failing to elect, unfortunately, the first female president. Dr. Somani is the chairman of the Ohio Doctors for Biden and is also co-chair for the Physicians Action Network Board. She's also past president of the Columbus Medical Association. She has two millennial children. Her oldest is an engineer and is a Democratic delegate from Detroit, while our youngest is an Ob-Gyn resident and also politically active with organized medicine. Her husband's a retired financial planner and is her biggest supporter. So we're really thrilled to have her here today. And you can have the floor, Dr. Somani.
Thank you. Thanks. So I'm really excited to do this. I think that doctors in politics is one of those things that you don't really think about when you go to medical school. You think about becoming a doctor, you think about how you're going to take care of patients. But the reality is that as physicians, part of our job is now to look at the political ramifications. When you think about healthcare policy and how so many of our regulations, so many of the things that we do day to day are impacted by politicians, we really do need to be involved. We need to be out there talking about what makes sense from a healthcare perspective. Looking backwards to look forward is something that I think is really important. As an example, when I was in residency 30 years ago, our local Catholic hospital had an arrangement with Planned Parenthood for residents to work in the clinics and provide contraception and counseling for patients. However, in today's world that has become so partisan, that collaboration would never have happened. So let's go back in time. One of the questions I have, and it's probably a history question, is how many of you know who our president was when Title X passed? Actually, probably the better question is how many of you know what Title X is and why it's critical to economic health? It was in the news a few years ago when Trump took away Title X funding from Planned Parenthood, but Nixon was actually president in 1970 when Title X passed. That program gave funding to clinics that provided contraception, preventative health care, pregnancy diagnosis, and counseling. One of the reasons I went into OBGYN is because I truly believe in preventative care. I think that's so critical to a healthy life, to a healthy lifestyle, to minimizing disease. And so Title X was a wonderful, wonderful way to help people, to help women. And Congress at the time made it very clear that one major goal of Title X would be to decrease the adverse health and financial effects on families who inadequately space their children. So one of the things that we do know is that if you can space your children, if you can plan your pregnancies, it allows you to pursue a career, it allows you to pursue an education. And it's also at that time was viewed as essential to abolishing poverty, to helping to decrease the world population because they were concerned about overpopulation, which we're still seeing today. So by giving low-income women, and so really the whole purpose of Title X was to equalize care. So by giving low-income women equal access to contraception and reproductive care and preventative care, it would allow them, their families, and it would allow them the benefits of being able to pursue an education and to pursue a career before they started their families. So in that same environment, Roe v. Wade passed in 1973. At that time, it was a bipartisan vote of 7-2 on the Supreme Court, and it was based on the idea of the 14th Amendment. However, because it was a law that was actually, or it was a ruling by the Supreme Court, it was something that was able to be chipped away at. So anti-abortion laws by different states have challenged and chipped away at the original intent of Roe v. Wade. So even though Amy Coney Barrett made the point of saying, you know, I wouldn't overturn something or Roe v. Wade won't be overturned, the bottom line is that when states start to chip away at those abortion rights, when states start to create anti-abortion laws, that unfortunately does restrict abortion. It restricts the ability of women to get abortions. And In 1992, Justice Ginsburg spoke out against this because the Supreme Court ruling in Planned Parenthood versus Casey allowed states to restrict abortions for non-medical reasons. She clearly at that time stated what we know now, that unfortunately the burden of these laws falls on poor women, on women who don't have access to care, on women who can't afford to take time off. So the laws that we've seen, being passed are those that require parental consent, or those that require an ultrasound, or those that require 2 visits in order to get an abortion. All those burdens then fall onto poor women. Before Roe v. Wade passed, women who were rich could afford to get an abortion. They would travel to states where it was legal. But the women who couldn't were forced to either contend with what their states offered, or they had to save up money and try to get an abortion, or they had to risk their life for an illegal abortion. So that is something that as a society, we should be encouraging Congress to pass federal laws that actually support abortion care. Abortion care is medical care. It's not any different from me providing a pap smear, me providing surgery. It is no different than that. And unfortunately, it's been politicized. And I kind of joke sometimes and I say, you know what? If abortion was to become illegal, what would Republicans actually be what would their platform be? Because most of the time they can sway people to vote for them by being, quote, pro-life. And, it's not about anti-abortion, it's pro-life, but I'm pro-life, I'm pro-choice. It's all in wording. So I think that the reality is if you are a politician, you may never want abortion to be completely illegal, because then what is your platform at that point? So again, encouraging Congress to pass federal laws supporting abortions. By increasing access to reproductive care, it allows women to control their own destiny from an economic, from a health perspective. There's no reason to force women to have children. If you're going to do that, you also ought to be able to provide the support to raise those children, the ability to not end up having children living in poverty, not being able to get food because of the fact that their mom is trying to make ends meet. So what is, again, in today's world, what are we looking at as we look forward? Looking forward, the COVID has really opened up some of the fault lines in our society. And one of the things that it's opened up around the world is that this crisis is not gender neutral. Actually, no crisis is gender neutral. Most economic crises hurt women more. The United Nations actually did a report on this and showed that women are bearing the economic and social fallout of COVID in many ways. Generally speaking, even in medicine, women earn less than men. They have less savings over a lifetime, and they're more likely to be in that informal economy of childcare, restaurants, and domestic work. So even a college-educated woman is going to be more likely to be burdened with the logistics of figuring out, what am I going to do about childcare when the pandemic hit and school shut down and online schooling was happening. I had several friends with child-age kids that had to juggle, hiring someone to watch their kids so they could work, or cutting back on their hours because both they and their husband were physicians. So even no matter what your socioeconomic status, that burden, that responsibility of caring for your children falls typically on the women. So the fallout of that was that reports showed that between February and October of 2020, 2.2 million women left the workforce. So what? So they went, so what did that do? Well, it displaced maybe the childcare arrangements. So those childcare workers that were taking care of those working women's children now lost a job. If you had women that were in the workforce and now they're home and they're helping their kids in terms of online schooling, when they go back to work, they're going to be paid less. There's a gap in their employment history. They may have to return to entry-level positions. The jobs that they had may be eliminated. That's something that we're going to see more like restaurants or retail or even childcare industry. There may be less jobs available. Some of those women may never go back to the workforce. So another report that was released by the United Nations showed that because of the pandemic, 96 million people will fall into extreme poverty by the end of 2021. of which 47 million of those will be women and girls. Up until this point, there had been a decline in global poverty. But because of the pandemic, we're going to not only see more women and children falling into extreme poverty, but it's going to widen that gender poverty gap. The woman who's a single mom, the woman who doesn't have a social safety network, the woman who has their own business. A lot of those women have lost their businesses or lost their income sources. So the ones that have been hit hardest are also those that tend to employ more women. So we all know, we know food services, we know that restaurants have shut down, retail has been affected. I mean, how many of us are ordering everything online these days? Entertainment, you don't even think about that. But I mean, we used to go like to the Broadway and stuff. Oftentimes those are, more women are in those industries, more women are in the arts. So all of those are good. And the last COVID relief bill that passed, Congress missed a huge opportunity by not supporting and addressing federal childcare laws. That would have been the time to support childcare workers and to offer free childcare so women could have stayed in the workforce, so that women didn't have to give up their jobs, so the women who worked in childcare didn't lose their jobs. But we missed it at that point. So that's something we need to think about and we need to address. We need to, as physicians, talk about that. A lot of us are physicians and moms. A lot of us are working moms, so we do need to think about that. So what does that have to do? As far as I'm concerned, healthcare, economic security, all kind of intersect when it comes to being a doctor. I never talked about politics when it came to medicine when I saw patients, but I realized that a lot of the laws, a lot of the things that we do, that politicians do, impacts our patients. So over the last couple of years, I've become more and more open about discussing things like the Accountable Care Act and the benefits it provides people, talking about poverty and how food insecurity affects people. It's amazing when you start talking about that, you hear from your patients about that too. So what can we do? We should advocate, we should talk about, where do we go from here? Can we advocate for laws that protect not only women, but their children also? Can we talk about things like, addressing food insecurity, providing maybe even something like Social Security where we all pay into it with our taxes. So it's an idea that seems radical, but is available in other countries where you get paid child leave or paid paternal leave, paid maternal leave for a year. So you can support, and see your kids through that first year of life. And you may think, well, I'm never going to have children, or I'm a single male. Why would I want to pay into that? That's not going to benefit me in any way. But the reality is that it does. It benefits everybody. When women can work, when women can stay in the workforce, when your children are cared for, it improves the global economy. It creates a growth economy. So it is important. It's just like when you think about things like car insurance or homeowners insurance, that risk is divided among everyone. Whether you're a high risk driver or a low risk driver, you may pay a little bit more if you're a high risk driver, but in the end, everyone's contributing to that. And that's something that we need to look at doing as a society. We really need to improve on our childcare. We need to set up laws that support parents. Some of us are dealing with aging parents and having to, I don't know how many of you have had the experience of trying to get your parents vaccinated, but my parents are in their 80s, and getting on to get them vaccinated was a challenge because most of the people in that age group are not super computer savvy. I mean, some of them may be, but you had to get online. For us, we had to have an account with MyChart or through Epic or through your hospital system. So setting up those accounts, getting the appointments scheduled, all those things impacted. And again, who does it impact? It impacts, the parents, but you as the woman, or you as the son or daughter, are the one that's sandwiched between your parents. What is it about vaccines that people are anti-vaxxers? And it's interesting to me, and I've seen it because when you travel around the world, vaccinations are something that if you're in a third world country, people line up. they will spend hours waiting to get their children vaccinated because they have seen their children die of those same diseases that here in the United States have been eradicated. And so that idea of being an anti-vaxxer comes from a point of privilege. It comes from the idea that you've never seen those diseases. And we're seeing that with COVID, this the fears, the scares of, is the vaccine safe? It was made so quickly, how can it be safe? But we can all, as physicians, talk about the mRNA mechanisms. The science behind that has been studied for years. And so it's more about understanding that technology was then looked at for the COVID virus, and it happened to work. And then the other point is vaccines for pregnant women. The World Health Organization came out and sort of confused people a little bit because they were talking about women who are pregnant should not get the vaccine. But ACOG, the American College of OB-GYN, actually said there's no difference whether it's Moderna or Pfizer. We really want to encourage pregnant women, especially pregnant women who are in high-risk professions or are in high-risk situations, teachers, doctors, nurses, should get the vaccine because it is protective. It protects them, it protects their baby. When COVID first hit and we were seeing patients that delivered, we really didn't see much impact. But now, we're almost a year into this pandemic, and I don't know that the data is there yet, but anecdotally, and my daughter who's an OB resident and talking to OB residents here in town, there has been a much higher incidence of like preeclampsia, of just bad outcomes, whether it's, growth restriction or stillbirth. So I think, when we go back and look in 5 years, we're going to see some definite impacts when it came to pregnancy. So again, I am strongly encouraging women to get the vaccine. One of the questions is, how do we help with trust in science and medicine? I think that's getting away from that idea of everybody's an expert, therefore no one's an expert. Patients, and they tell me they've done their research or they know, from doing, I am very specific about asking, well, what research did you do? Let me help you identify the more reputable sites or direct you to places where you can get good information. So one way you could rebuild public trust is to acknowledge that people do go on Google, they do tend to, to use, but that search engines will put at the top of a search engine whatever people are looking at the most. So rather than using search engines, you can talk to them about maybe going to ACOG's website or going to sites that are reputable and looking at those. Interestingly enough, when vaccines were talked about last fall, public trust in vaccines was very low. One of the things that I think we did as physicians that was really, really effective was directly taking to social media and sharing our stories of getting the vaccine, the side effects we had, why we got it. And as a result, public trust went up from 40% of people wanting to get the vaccine to 60 to 70%. So I think that social media is a double-edged sword. I think that in many ways we can do good with it, but in many ways there is the dark side or the negative side to it. Another question I see here is, how do we explain to our legislators that healthcare is more than just insurance? That's a great question. So again, pointing to, and I think we have to look at all of it. We have to look at, and I talk about this a lot. Food is health. When you think about food as medicine. So if we could talk to our legislators and talk about the impact that poor food, whether you make poor food choices or you don't have access to healthy food, there are places that we call food deserts, even here in Columbus or any inner city that you go to, there's food deserts where there's no grocery stores that provide fresh fruits and vegetables. So talking about that in relationship to healthcare and the importance of minimizing again, when you go back to the cost of healthcare, it comes from treatment, it comes from medications. So what if we could decrease the incidence of diabetes by getting, sugar or pop out of the school systems. That's something we've known for years, but we battle the bigger industry, which is the soda industry. So again, teaching, that starts with education. It starts with public education. I think, again, if you can, simple things like teaching kids about making good food choices, avoiding sodas, avoiding sugar in the first 5 years of life, you may help reduce the risk of diabetes. Talking about salt, talking about cooking on your own. Those things are so much more critical and so much more important. Even we need to support the food industry and maybe subsidize the healthier stuff and not so much the unhealthy stuff. I'm trying to see, there's so many other questions, I think. How do we mitigate that's a good question. That's a great question. So not only is there a disproportionate impact on women and girls, there's also a disproportionate impact on minorities. I think we're seeing, that the racial riots, the Black Lives Matter, all of the things that happened last year happened to happen in that. But what it did was it really, really increased the awareness. And I see it just in medicine, how we are becoming more aware of our implicit biases and racism and how we effectively change care. So, there's outcomes where Black physicians, whether it's an OB-GYN or internal medicine specialists, their outcomes are better with their patients because their patients relate to them. They trust them. I think when you look back on the history of medicine and you look at things in OB-GYN, for example, Dr. Sims, who we all think of as being this amazing gynecologist, but the fact of the matter is he practiced on African-American slaves, and that's a horrible thing to think about. Or the idea that Black women don't feel pain, so we undertreat their pain. Those are things that, again, it's a disproportionate impact, not just their overall health. So addressing distrust, talking to our patients, whether they're minorities or Caucasian, the idea of vaccines and how important they are, why they will help them and why they shouldn't be afraid to get a vaccine. In terms of healthcare, being conscientious about your own implicit biases, trying to understand where someone's coming from. Someone doesn't listen to you in terms of whether they quit smoking or they continue to eat poorly or they didn't take their medications. Trying to understand where that's coming from. Is it because they couldn't afford their medications, because they had to pay for their kids, formula or diapers, or was it something that they didn't understand about the medicines you prescribed? Just asking that simple question of how do you see this, or what do you see as this being helpful or hurtful to you, maybe will help you to understand how to provide better care to them. And not discounting people. I think a lot of times people have a good sense of what's wrong with them. Sometimes I'll ask, well, what do you think is going on? Or what do you think affected, how you feel? And that can also help you go a long way towards creating that collaborative relationship.
So I'll leave it to the last question here because I know we went more than 15 minutes, but it's such a good question I have to ask it.
Okay. So the direct impact of COVID on women's health, particularly among long haulers who appear to be heavily women. So again, some of those symptoms, and I've had patients tell me about it. And I mean, I've had patients who got COVID in last like March and April and May. And so many of those symptoms almost cross over with symptoms of what we consider sort of psychosomatic diseases. When you hear about things like fibromyalgia, or you hear about women who have other issues in that same sphere, the long haulers, that say they've got that fogginess of their memory, or like I had a patient who had severe nerve pain, like she had been a runner, she was super healthy, 38-year-old, and now she had like pins and needles shooting down her legs. She had almost like a fibromyalgia kind of fatigue. She said she couldn't remember things. She had the fogginess. So I think that unfortunately, a lot of these diseases fall into that sphere of, because we don't have good tests, because we don't have a way to prove someone has it or doesn't have it, we tend to disbelieve. We tend not to believe the symptoms. And I agree, it's not coincidental. It's because men may brush it off, or they may not talk about it, or they may think, well, I don't want that person to think I'm crazy, so I'm not going to talk about it. Whereas women are maybe more willing to ask for help or look for help when they have symptoms, but then they get brushed off. So we need to understand that there are going to be a lot of impact. And that's another reason that we need to think about some sort of universal health insurance, because COVID and the long-term impact of COVID is really, really going to disrupt our healthcare system if we don't have something in play.
Thank you so much, Dr. Somani. You had so much good information, and you covered so many aspects of healthcare, and you really speak on how healthcare is just more than just insurance. There's so many other factors that go into it that not many people think about. So thank you so much, and we'll end it today. I know there's so many people asking questions, but I don't want to take up too much of Dr. Somani's time. So thank you.
Thank you, and keep doing what you all are doing, the doctors in politics. We need physicians to run for office, and we need physicians to advocate for their patients. So thank you.
Maybe Dr. Somani in the future. All right. Thank you, guys. Take care. Bye.